We continue speaking about the tips. And well, now if we move to this slide, we can see that there are some more questions about things that you need to do before you carry out a procedure. So here there is a tip that you should obtain consent from the patient for the procedure. So as you see, consent is agreement of the patient. Sometimes it should be a legal agreement. It can be like a contract agreement document that the patient signs that he agrees that the procedure will be carried out with him. Yes. Why do you need to do this before the procedure? So who can comment?
Can I reach you?
Your name?
Mohammed Ayub.
Okay, please.
They are asking for the signing of some papers, the doctors, but the patient must sign it before doing like surgery or some things. Because the reason is if suddenly something happened, they should have this paper that show that the patients are also agree with this by doing these things. Like the agreement is so important from the patient to take.
Yes, this is about agreement to take some risks, but
yes.
It can protect both patients and a patient and a doctor. So, and the doctor should give as much information about the procedure as possible to the patient. And if the patient just signs the document, so all the risks are shared, and it's very important, right? Well, why do you need to do to introduce yourself before you carry out a procedure? Why? Let's listen to Mohammed Nabil. Hello, Mohammed Nabil, are you here?
Yeah, doctor, as you know, it's necessary for the patient to know the name of the doctor. Also, maybe the patient, in case that he can't read the name that the doctor wearing.
Yes, on the page.
Yeah, maybe he's tired, maybe
the eyesight is poor.
Yeah, right. So you have to introduce yourself.
I see. Yes, so that just to know the name of the person who takes care of him or her. And why so do you need to prepare the trolley? The trolley before the procedure. So let us listen to Horalai. Horalai, are you here? Is Horalai here? No, minus. Tala, please.
Yes, teacher, because the safety of tools must be ensured so that the patient is not exposed and to any dangers. And check it, totally it's important to order carry the patient to be must be to insured so that patient not exposed to any dangerous.
Okay, just to have all the instruments and tools on hand to access them easily. Ahmad Sami Krishan. See. Yes, thank you. Sometimes, for example, in a dentist's office, some patients are scared when they see a lot of instruments, and so the dentists just tend to cover the trolleys with the instruments, just not to show the patients. Okay, and now if we have a look at the next slide here, there is information. There are instructions for a procedure. We don't know what procedure it is, but we should analyze these steps and so decide. You can see that there are gaps. We should decide which verb is better to use in each gap. So if you look through the sentences, you can see that there are several abbreviations. Like in line B, there is CSF. Corolla is coming. So CSF stands for cerebrospinal fluid, the fluid inside the spine, inside the body. And in line C, there is the letter L. It stands for lumbar vertebra, also part of the body. And yes, and maybe we need to comment on the word stylet. So in line A, stylet is a kind of a catheter or a tube that is used in medical manipulations, in medical procedures. Well, and so the verbs prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. If, for example, we speak about attach, this is like connecting something together, tying, and obtain, for example, is get, withdraw is take away. Well, so which word is better to use in the first line, line A? What should we do with the stylet? Any ideas?
Maybe attach or
Attach the stylet, yes, possible. One of the it's possible to use attach the stylet.
Can it also be
Withdraw the stylet, yes. You see that there are pictures of needles here, yes. So if we speak about attaching, this is, and withdrawing, this is attached to the needle and withdraw. Yes, and we can also see the specimen tubes and manometer also. By the way, manometer, what is it used for? Manometer, what does it measure?
Is it for blood pressure?
Blood pressure or some pressure of some kind of, yes, other liquids or blood pressure, yes, exactly, you're right. And well, yes, so if we look at line B, this is about 10 drops of fluid into the 3 specimen tubes. The tubes are shown in the picture. Well, what should we use in B line? Yes, Mohammed.
Prepare maybe.
Prepare 10 drops. Do we get the drops from outside the body or from inside the body?
No, that's drain 10 drops actually.
Yes, from the body. So this is drain 10 drops and they move to the specimen tubes. Well, what about line C? About the point between vertebra 3 and 4, where the needle is to be inserted.
mark, maybe.
Mark the point, exactly. So just we need to understand where we just do the injection or insert the needle, yeah. Then D, your hands and put on sterile gloves. Let us listen to Mohammed Wiem.
Wash.
Yes. What is
Wash your hands.
Exactly, yes. This is one of the common procedures, like washing the hands. Okay, and put on sterile gloves. Then E line, consent for the procedure. So, Sadin Asaf.
I think obtain consent for the procedure.
From the patient. Yes, this is very important step. Line F, the area of the patient's back. The area of the patient's back. Kazaina, please.
Sterilize.
Yes, we've marked something and then the area, we sterilize the area. Now the equipment on the trolley, this is line G and line G. Tala, please.
It's prepared.
Yes, prepare the equipment on the trolley. And what should we do with the manometer? The last line.
It is attached.
Attach the manometer. Yes, of course, just to control the situation, to control the pressure. And so here they are. Yes, in the sentences, withdraw the stylet, drain the drops, mark the point, wash your hands, obtain consent, sterilize the area of the patient's back, and prepare the equipment and attach the manometer. You see that these are some of the steps of the procedure, and some steps are missing, but anyway, we can put them in the correct chronological order. So because we don't start our instructions with withdraw the stylet. This is the last step in the procedure. What is the first step? What can be the first step?
Maybe to wash your hands.
Okay, possible. Yes, wash your hands is possible, because you should yes, wash your hands before you start any kind of procedures. Yes, Mohammed.
Prepare,
Yes.
prepare the equipment on the trolley.
Yes, this is just prepare everything you will need in the procedure. Then, or we
Can
can.
it be like changing of the clothes, like need for the special clothes?
Okay, so
Should we?
yes, you're right, but we are speaking about only the steps which we can see here on the screen. So,
I have a question.
yes.
For the first one, instead of washing your hands, could it be obtain the consent for the procedure?
Exactly, you are right, because this is if the patient doesn't give the consent, we can't, there's no sense in preparations. Yes, you are right. First, we should obtain consent from the patient, and then we prepare the equipment, wash our hands. What should we do first, wash hands or prepare the equipment?
Prepare.
Prepare the equipment. Why? With the dirty hands or what?
First, we should wash our hand, and then we prepare the tools.
Maybe we can divide instruction into two parts. Yes, we wash our hands and then we prepare the equipment, and only then we put on sterile gloves, right? So then what comes next? Let's listen to Sadin Asaf.
Yes, I think we have to mark the point between the L3 to 4 where the needle should be inserted.
Yes, find this point, mark this point. Then the next step.
Maybe attach the manometer or withdraw the stylet.
No, withdraw the stylet. This is the final.
That's the end. Yes, that's the final step.
Okay, so we can attach the manometer even before we mark the point. Yes, just to prepare everything. Yes, what is the next logical step? If we have marked the point where the needle is to be inserted. What should we do with this site?
I think we need to sterilize the
Yes,
area.
sterilize the area of the patient's back, and then the procedure itself. This is, what's the aim of the procedure? This is to get the fluid, right?
Yes, so
So
Yes.
this drain 10 drops of fluid into the 3 specimen tubes, and the final is withdraw
withdraw,
this
yeah.
stylet. Yes. What kind of procedure is described? What is it?
Injection.
Injection. Injection is just moving some medicine inside the body. Injection, but this is just getting 10 drops of fluid from the body into the tubes. Can it be injection?
Oh, no, never mind.
So, and this is about what kind of fluid? This is cerebrospinal fluid. So what do we call this kind of procedure? Okay, so this is a lumbar puncture, and this is the procedure of taking fluid from the spine in the lower back through a hollow needle, usually done for diagnostic purposes, spinal tap. And you can see pictures that show the position of the needle during this procedure between the vertebrae. And so the posture of the patient. So during this procedure. Well, okay, so that is all about the instructions and procedures for today. And I would, before we start speaking about the test, I would also like to show you one more presentation where we can revise some terms, medical terms that can be used in, yes, that you can meet in the test. Now I'm going to share the screen, and this is the in the kind of a game. So welcome to the questions maze. So this is the maze. Can you see the picture?
Yes.
Yes.
And well, what should we do? We should find the center of the maze, and we should choose whether to turn left or right to go straight forward, not to get lost. So choose the correct answer to the question to go the right way. If you make a mistake, you might get lost. Now let's get started. And the first question, I'll read it. This is, we are at the entrance of the maze, and we need to choose to turn left or turn right. Which medical job involves implementing standard policies and procedures that keep the practice running smoothly? They supervise the facilities office staff, hire and train new staff members, and manage finances and budget operations. Is it a practice manager or general practitioner?
Practice
think
manager.
it's practice
manager.
manager.
Check it. Let's turn left.
Yes.
It takes, yes, you're right. Okay. Now the next question. This is a person who greets and deals with clients and visitors to a surgery office, etc. Is it health visitor, receptionist, or practice nurse? Should we go ahead, turn left, or turn right?
Receptionist.
Receptionist.
Okay, we should
Reception.
turn left. Let's go left. Yes, okay. Now this is a doctor who treats patients with minor or chronic illnesses and refers those with serious conditions to a hospital.
General practitioner.
I see. This is a trained nurse who visits people in their homes to assist or advise the chronically ill or patients with very young children. Practice nurse or health visitor?
Health visitor.
Sure. Okay, all right. This is a person, typically a woman, who is trained to assist women in childbirth.
Midwife.
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 Let's go straight ahead. And now this is a nurse who visits and treats patients in their homes, operating in a specific area or in association with a particular health center.
District nurse.
We should turn right. And this is a registered nurse based on a general practitioner's surgery who works with the GPs to care for the patients seen at the surgery. Is it district?
Practice nurse.
Practice nurse.
Mhm. This is a condition, no, a chronologically written account of a patient's examination and treatment that includes the patient's medical history and complaints, the results of diagnostic tests and procedures. What do you-
Patient records.
Presenting complaint.
No, wait, 1 second. No.
Complaints.
what is it?
Presenting complaint.
Presenting complaints.
No, it didn't. So we need to start again. So medical job implement.
I have a question.
Yes,
Does that mean the last question was wrong or one of the questions?
the last answer was wrong. We have chosen wrong way. Yes, it was
Okay.
wrong. Now we need to start with the beginning. Who supervises?
We have to return.
Is it practice manager or general practitioner?
Practice manager.
Person who greets visitors.
Health.
Receptionist.
Receptionist.
Yeah.
Doctor who treats patients with minor chronic diseases.
General practitioner.
Trained nurse who visits people in their homes.
Health visitor.
Woman who helps assist women.
Wait.
Midwife.
Midwife.
This is a nurse who visits, treats patients in their homes.
District nurse.
District nurse. Registered nurse who helps general practitioner.
Practice nurse.
Yes, chronologically written account.
Yeah, patient
Patient record.
Patient records now. Yes, if you choose patient records now, yes, it's right now.
List and
Another definition.
Presenting complaints.
Yes, this is presenting complete list of and description of health problems.
What?
Did I do something wrong?
Appendicitis.
You pressed it by mistake.
Okay, so one more time. Practice manager, receptionist. Was this
General
general
practitioner.
practitioner, trained nurse, health visitor, right?
Yes.
A woman midwife,
Midwife.
visits patients.
District
Nurse, a registered nurse based
practice nurse.
Practice.
chronological written account.
Patient record.
Records, and now list presenting, right? Already pressed.
Complaint. Yeah, presenting complaint.
This is the list and description of the health problems and issues experienced by the patient resulting in attendance.
Yeah,
Yes.
presenting complaint.
I see. Which condition do you associate with a sharp pain at the right side of the stomach?
Appendicitis.
Yes.
Yeah.
It's not tension headache, it's
Appendicitis.
angina pectoris, this is appendicitis. And which condition refers to pain that radiates along the path of the nerve, which branches from your lower back through your hips and buttocks and down each leg. Is it ureteric colic or sciatica?
Sciatica.
Sciatica.
Yes,
Sciatic
something
nerve.
in the leg, sciatica. And now, which condition do you associate inflammation in the stomach caused by belly pain?
Gastritis.
Exactly, gastritis. Congratulations, you found the
Yes.
central maze. Okay, and I hope that it helped us to revise medical terms. And if we go to our, our previous presentation, this is like the information about the test you are going to take now. In several minutes, I'll open the test for you on the Moodle site, and so there is some information about the test. So the test covers the grammar structures and vocabulary of units 1 and 2. And so it consists of 35 questions. And there are 4 types of questions in the test. So the first is multiple choice questions. Most of them are multiple choice because they are grammar questions. You will see a sentence with a gap and 3 or 4 options, and you should choose one correct option. So, yes, this is grammar. Then the next type of question is true-false questions. You will see a statement, and you should decide if the statement is true or false. So you agree or disagree. So maybe it will be a definition, for example. Then the next type of question is batching questions. For example, you'll see 4 terms, medical terms, and you click on one of them and you will see 4 definitions. And you should choose the correct definition for this term. It means you should match all the terms with their definitions. And the last type is select missing words. You will see a text, a short text, and you will see several gaps in the text, and you click on the gap and you will see some options in the pop-up menu, and you should choose the best option for this place in the sentence. When you are finished, you've done all 35 questions, you should just click on save button or submit button, don't remember. So there will be something on the screen, and you will just submit the test and you'll get your final score. The time for the test is 50 minutes. It means that when I open the test, I'll open, now it's 1:30 in Almaty. So I'll mark the time 1:30, and the test will close automatically in 2 hours. I'll give you 2 hours. It will be 3:30 Almaty time. And so you should just start doing this test, and you should calculate whether you'll be able to finish the test till the test closes. Do you see? And when you start taking the test, you'll be given only 15 minutes. You can see how much time is left on the screen. You will see the time countdown. Is everything clear about the test?
Yes.
Yes, teacher.
Yes.